안녕하십니까. 디지털 허브 치과의 천세영 원장입니다.
Greetings, I'm Dr. Chun Se-young of Digital Hub Dental Clinic. Today I'm going to talk about CAD-CAM software in depth. By digital dentistry, it encompasses all dental treatment performed using digital scanner, computer, CNC, and 3D printer. The entire process can be called as digital dentistry. Data such as oral scanner and CT data are used to proceed with all processes. Under the name CAD-CAM, all manufacturing process, fabrication process is preceded. It replaces what was done manually, and there are differences in that aspect. If you look at the workflow, for digital scanning, all work needs to be done on the computer. Therefore, scanner and CT is used to gather data. Various software is used to design and do treatment planning. CNC milling machine or 3D printer is used to fabricate surgical guides, denture, and crowns. Today, I want to focus on the software, which is in the second line here. CAD-CAM software can be divided into various types, but it can be largely divided into CAD software and CAM software. In CAD, you can work on prosthodontics, orthodontics, and implant planning, and CAM software manipulates the milling machine. It also handles a slicing process for 3D printing. In digital dentistry, the ways to come up with prosthesis, it can be divided into additive manufacturing and subtractive manufacturing. As for additive manufacturing, you build up materials to fabricate prosthesis. On the other hand, subtractive method requires a use of CNC milling machine to fabricate prosthesis using burr. This is how it's divided. First is CAD software for prosthodontics. A lot of companies have CAD software. The most notable software is 3Shape's Dental Manager and ExoCAD's ExoDental. You can see how crown and abutment is designed using 3Shape. As shown, crown and implant prosthesis is fabricated in this way. In the past, conventionally, we would do it manually, and now this software can reproduce all such processes. The accuracy and performance of the softwares have improved significantly. The precision, in some sense, the digital dentistry is better than what was done by human. Next is the software used to plan implant and to fabricate guide. This is used very frequently. This is Implant-studio from 3Shape and Exo Planning from ExoCAD. Using Implant-studio, this is the design for implant planning. Scan data of upper and lower is uploaded to the software. CT data is also uploaded. Most of digital softwares use a surface data and 3D data gained from CT. Let me talk about orthodontic softwares. A lot of people think that prosthodontic softwares are the mainstream, but as of late, a lot of orthodontic softwares are getting limelight. These orthodontic softwares have been there for a long period of time and have been utilized in orthodontic treatment. The performance and function precision is increasing significantly recently, and now it is possible to provide a very precise appliances and setup is possible. Ortho Analyzer from 3Shape, Maestro, and ExoOrtho from ExoCAD. These are the most prominent softwares, and there are many alternatives out there. You need to weigh the pros and cons of different softwares and choose the software that fits your description. Then you'll be able to improve the quality of your orthodontic treatment. This is how the orthodontic setup is done at my private clinic. This deciduous tooth is extracted. As shown, number 44 needs to be aligned, and after that, in the empty space, implant treatment will be done. Before implant placement, I'm simulating orthodontic treatment. Let me show you the video. In the past, you'd proceed with orthodontic treatment first, and following that, you check the space. You'd determine whether you're going to proceed with the implant treatment or bridge. But now these days, with simulation before orthodontic treatment, you'd be able to anticipate whether implant treatment will be possible after orthodontic treatment and how prosthesis can be fabricated. These can be verified before proceeding. More accurate results can be provided to the patients in this way. In my clinical practice, I use a lot of appliances like CR Splint. When I do this, I want to talk about digital articulator. In CAD-CAM software, the patient's mandibular jaw movement can be scanned and it can be reproduced in the virtual articulator, and you can check the Bennett angle and condyle eminence, as well as incisal angle. The mandibular jaw movement can be shown in many different ways. By doing so, you can see where the interferences are in red. Also, you can selectively remove what is marked in red on the software. That is being done right now. As shown, where the interferences are automatically on the software, it is removed. By using this CRS, if you print it out using 3D printer or a milling machine, you'll be able to provide a more accurate prosthesis and reduce the amount of time required for occlusal adjustment. Because you're providing prosthesis that has gone through simulation, the precision would go up. If you set it, it fits well. It's more convenient for the patients. In prosthodontics, in the past, a lot of people had their doubts. They doubted whether the crown fabricated via CAD-CAM would fit well and whether it would have good sealing, whether it would have good precision. A lot of questions have been raised on that point. But these questions are no longer raised these days. Zirconia crown and other crown fabricated with CAD-CAM. Many people now acknowledge the precision and accuracy of these prostheses. As shown in the image, in the margin, the adjustment of the gap can be done in micron level for the prosthesis natural tooth and implant abutment, and cement space can be adjusted by micron level. When you mill using CAD-CAM machine and print it out with just a 3-4 micron difference, the prosthesis can feel loose or tight. You can adjust up to the 3-4 micron level. Therefore, you can get a very precise result, which is better than the prosthesis you got with casting. The precision, accuracy, and reproducibility is much better. The crown that is designed, you put that in the CAM software, and here you can see zirconia crown. You can determine how it's going to be fabricated and how you're going to add support. This is called the tool path using burr. Using different types of burr, it is fabricated, and I'm going to determine how it is going to be milled in the next stage. In terms of fabrication, I can determine the order and the path. Using this software, these can be calculated ahead. If you send the tool path to the milling machine, zirconia block can be milled following what is determined. This is the CAM software. Next, I'm going to talk about the 3D printer CAM software, which is being used very frequently. If you look at the 3D planning design software, you can set the size, angle of support, and various conditions can be set in a very detailed manner so that the crown can be designed very precisely. For stability of a printing, the angle and position can be determined. This is a 3D printer CAM software, in a sense. By doing this, if you print it out, the crown is accurately printed out. This was the calculation, and the 3D printer prints out the result as ordered. In this way, printing is proceeded. Let me show you a case. This was a digital multidisciplinary treatment case. In this case, the patient was a 55-year-old male patient. The patient received orthodontic, prosthodontic, and implant treatment using CAD-CAM digital technology. If you look at initial visit in number 24 and 25, caries was extremely severe. The first thing that comes to mind is to extract the 2 teeth. The original plan was to extract the number 24 and 25 and to provide implant treatment. The second was to do orthodontic treatment on high canine and to place implant in number 25. The patient chose the second option, and if you look at the order, as mentioned, orthodontic software is used to treat high canine. Number 22 and number 23 were to be aligned in an ideal manner, and in number 25, implant and prosthodontic simulation was done. Before orthodontic and prosthodontic treatment, all treatment process were simulated and implant and appliance positions were set. Surgical guide was to be used for surgery. Using the patient's case after extraction in number 22 and 23, digital setup was done. Number 23 high canine was aligned carefully. I try to find the most ideal occlusion for the patient. In number 22 and number 23, I wanted to adjust it so that the patient had ideal occlusion, and this was the proposal I made to the patient, and the patient agreed. Rather than pushing ahead in a traditional way, I set up the orthodontic treatment first, and once orthodontic treatment is over, in line with the space that has been secured, implant placement will be done as shown. Before orthodontic treatment and implant treatment, by having this a set up stage, I attempted to plan the implant. If you look at the workflow, orthodontic setup was done first, and the anticipated maxillary adjustment. The patient did not go through any orthodontic treatment yet, but I simulated what it will look like after orthodontic treatment, and on the Implant-studio, I reflected such changes. You can make adjustment to reflect the proposed orthodontic treatment. In line with that, you can design the implant position and crown position. The patient has not gone through any treatment yet, but with the implanted design on the Prosthodontic CAD, you can use a 3D printing or milling machine to fabricate prostheses ahead. Before the patient goes through any treatment, these can be prepared ahead, and then you can proceed with the treatment. If you look at the Implant-studio, the patient has not gone through orthodontic treatment yet. On orthodontic CAD, you can get this kind of setup, reflecting the changes in the maxilla. This is all in the virtual space. The data is changed as shown, and in the Implant-studio, the CT and the virtual setup is matched to do planning. As you can see, the matching of other teeth are very good, but in the case of number 22 and 23, because it has been moved with orthodontic treatment, they are not matched. The CT is taken before the actual orthodontic treatment, and the setup is different. Therefore, they are not matched. Digital wax-up is done, and following that, you determine the right implant position. The patient has not gone through orthodontic treatment yet. The implant will be placed in the position that will be most ideal after the orthodontic treatment. After that, orthodontic treatment is done as shown. 1 month later, 2 months later, and this is 7 months later. If you look at here, prosthesis was fabricated ahead, implant was set, and as we determine how it will be like in the orthodontic setup, you can see that what we have assumed in the treatment planning process has been reproduced in real life. This has been done very precisely after 7 months. As you can see, this kind of result has been achieved. If I had used the conventional method for treatment, it would have taken 7 months just for orthodontic treatment, and after that, if I had done implanted treatment, it would have taken additional 3-4 months until the patient would have been able to receive prosthodontic treatment. Using the conventional way, it would have taken a lot of time, but using digital CAD software, the treatment period has been reduced significantly. 3 different treatments have been provided to the patient at the same time, and they have been verified before they were performed. These treatment processes occurred simultaneously, and that's why the result was all the more satisfactory. What used to be only possible in imagination can now be done in reality, actually. And this is all thanks to digital dentistry. I would like to summarize what I've mentioned today. If you think of CAD-CAM software, people think of prosthodontic CAD-CAM software. However, they can be applied to implant treatment and orthodontic treatment as well. You can proceed clinical treatment using these software. By using these softwares, you can provide accurate prosthesis with high-performing machines. Not only that, but you can improve the quality of your clinical treatment. How did you like the lecture today? I hope the contents of today were of help to your clinical treatment. In the next lecture, I'm going to address more of digital dentistry. This is the end of today's lecture. Thank you for watching.